Hello and welcome. My name is Amy Kovler, and I'm the chair of the board of directors of the PCD Foundation. On behalf of the board, I want to thank you for joining us this evening. This is our second virtual event, bringing together wonderful, generous, and dedicated individuals who are here because we all care. We share a desire to support increased research, accelerated diagnosis, improved health, and ultimately a cure for PCD. Tonight would not be possible without the help of some amazing people. I'd like to begin by thanking our generous sponsors. Your kindness and generosity play a critical role in advancing the mission of the PCD Foundation. This year, I am particularly grateful as 2 months ago, my 8-year-old daughter Alexandra had to be admitted to the hospital as her lung function had fallen. It fell lower than it had ever been, and she needed to be admitted immediately, kept in full isolation. This was a very humbling moment for me, as I truly thought PCD would never be very serious for Alexandra. I always assumed she would surpass all odds, and the stories I heard from other families would not happen to mine. I was extremely scared upon entering the hospital, but I was immediately calmed by the amazing team of doctors, nurses, physical and respiratory therapists that comprise the PCD Foundation Clinical Center at Ann and Robert H. Lurie Children's Hospital of Chicago. The level of care we received was overwhelming. It made the almost 2 weeks we were there go by with ease, knowing we were supported by the best of the best. However, the real ease I felt came from Alexandra. Her strength and grace as she faced something she'd never had before was beyond inspiring. She had a PICC line inserted with no sedation. This was something the doctors had never seen from a child of her age. She was determined to get her lung function up and motivated herself to do better and better with each test. She had a smile on her face every day, and her positivity got us through our stay. I am truly in awe of her spirit and perseverance. I always knew I was grateful for the work of the PCD Foundation, of what they have done to set up centers of excellence throughout North America, but I was never more grateful than I was in October. Not everyone has a clinical center nearby, and it made me feel even more focused on the work that we do at the Foundation to help patients like Alexandra find the best care possible in their own city. Our program this evening will give you an insider's look at the PCD Foundation Clinical and Research Centers Network, such as Lurie Children's. We will hear from PCD leaders as they explain what it means to be an accredited center and the impact the center's network has on PCD diagnosis, care, and research. The PCD Foundation oversees a rigorous application and approval process for center membership. The accreditation process, as well as the ongoing support provided to PCDF centers, requires significant resources and would not be possible without philanthropic support. We have set an ambitious event goal this evening of raising $200,000. If you have already made a donation, I thank you. There is still time to help us reach our goal, and with your support, we can accelerate research and make specialized care more available. This evening, we have provided special opportunities to support our growing centers network, and more importantly, our PCD community. Gifts can be made online through our event page, or if you opted in to receive text messages, you can make your gift directly on your phone. Now, before we begin, I'd like to extend a special thank you to Ann and Robert H. Lurie Children's Hospital of Chicago, not only for the care you recently and consistently provide to my family, but for their partnership in this evening's event. Lurie Children's is one of more than 40 expert centers across North America, and we are grateful to them for providing a special look into their accreditation process and PCD Center of Excellence. It is my pleasure to introduce their leaders, Dr. Tom Shanley, President and CEO, and Dr. Terry Laguna, Division Head of Pulmonary and Sleep Medicine and Director of the PCD Center of Excellence, who is also Alexandra's pulmonologist. I am personally grateful for their leadership and fortitude in enabling a PCD center to not just open, but thrive within Lurie's. It is also my privilege to introduce the Executive Director and Founder of the PCD Foundation, who is also my friend, Michelle Mannion, along with the Medical Director of the PCD Foundation Registry and Assistant Professor of Pediatrics at Monroe Carroll Jr. Children's Hospital at Vanderbilt, Dr. Michael O'Connor, and the Director of the PCD Foundation Clinical Centers Network, an Associate Professor in Pediatric Respiratory Medicine at McGill University, Dr. Adam Shapiro. Thank you all for joining for this evening's event.
PCD stands for primary ciliary dyskinesia, and it is an umbrella term for a group of genetic disorders that affect the structure and/or function of cilia in the airways.
Cilia may not beat correctly, and you develop mucus that is stagnant. PCD commonly has 4 key clinical symptoms, including neonatal respiratory distress, an organ laterality defect, meaning organ somewhere in the body is flipped in one direction or the other, and year-round daily wet cough and year-round daily nasal congestion since infancy. You suffer recurrent respiratory infections with different bacteria, and ultimately it can lead to long-term damage of the lungs.
The chronic cough, the chronic congestion, the coughing up of mucus, the difficulty with fluid behind the ears can really make a quality of life very poor for kids. One of the challenges in trying to diagnose it is trying to tell it apart from other things.
It can look like young children with their current viral illnesses in daycare. It can look like everything else. The other way it's misdiagnosed is through inexperience with some of the testing techniques. But once the diagnosis of PCD has actually been confirmed, the biggest things families face is the unknown.
When my daughter was diagnosed in 1991, we were pretty frustrated about the lack of research and the lack of any sort of therapies. PCD Foundation was founded by me and another patient in 2001. We started with the mission of accelerating research and to improve the lives of individuals and caregivers who are facing this disorder. The focus was to create a network of expert centers. We wanted to be sure we had a rigorous standard for the sites that we were incorporating into our network.
I'm the medical director of the PCD Foundation Clinical and Research Center Network. In this role, I am highly involved in choosing which sites to accredit. I train those sites in diagnostic testing, perform in-person visits to each site to make sure that all of the adequate supports are in place in order to be an accredited PCD center. They have to show the PCD Foundation, the entire institution, have made a commitment to PCD.
Being an accredited PCD clinical center is such a big deal because it means making a commitment to these practices of excellence, and it serves as central points where people with PCD know that they can go to these centers and get excellent PCD clinical care.
From a diagnostic standpoint, the subspecialties that are really necessary at a clinical site are neonatology, genetics, pathology, cardiologists, pulmonologists, otolaryngologists. A center needs to have electron microscopy analysis, genetic testing abilities, and nasal nitric oxide measurements. They are taught extensively on our PCD Foundation nasal nitric oxide protocol, and each site also purchases a chemiluminescence nasal nitric oxide analyzer. All sites will receive either a virtual visit online or visits in person to actually go over and validate all of their standard operating procedures.
PCD centers agree to participate in education, training, attend meetings, and in research studies.
But we know that accredited centers are doing everything right. They're at the cutting edge of diagnostic science.
As we look across this particular region, we realized that there was a major gap in the services for kids. We felt a strong responsibility to our community. We wanted to make sure that we had both the infrastructure capabilities as well as the personnel to be able to optimally care for kids that are impacted by PCD and really support their families. Making sure that we have all of the components necessary to be a leading center was just an important imperative to us. And that's why we invested in and pursued the opportunity to become a PCD center.
One of my first goals was assemble the team members. Having a multidisciplinary team allows us to make the diagnosis early, potentially preventing a lot of the complications. The components of my core team include a genetic counselor to help not just make the diagnosis, but help advise families on what to do about potential future pregnancies, a respiratory therapist who can teach families how to do airway clearance, who can perform the nasal nitric oxide test, nurses to help with the educational side of things and to help support families, ear, nose, and throat doctor to help address the problems that can occur with the ears and the sinuses, lung doctor, because so much of the care focuses on keeping the lungs healthy and then treating infections. The second thing was having a site visit by the PCD Foundation to watch and make sure that we had the adequate personnel and expertise that we could do testing. Then we received our accreditation. We became a PCD Foundation accredited center of excellence. That was a happy day. Having patients being taken care of at your PCD center allows them the opportunity to participate in key clinical research trials to better learn about the disease. Since Lurie Children's has become a part of the PCD Foundation network, we've had a number of substantial impacts on the care of PCD, improving the quality of life and ultimately improving life expectancy.
Our goal with accredited centers was to have in our network at least one site in every state, and we did find that that's not enough. We want to continue to grow this network across the country. We currently have just under 40. In 10 years, we'd like to see 150 centers.
What we hope is that as we continue to get broad participation and more clinical centers a part of the network, is that we'll have more and more people asking questions about PCD and how to improve the clinical care for PCD. And then we'll have this large ecosystem of data that people can utilize to try and answer those questions.
Our goals for the future is clinical trial readiness. That means getting our registry populated with patients.
One of the requirements for going through a PCD Foundation accreditation process is that you are willing to participate in this registry. Being willing to participate in the registry also means having the capability to enter data into the registry and the research support to be able to do so.
The PCD Foundation Registry is the single most important piece of technology we have. It will allow us to identify overall outcomes. It establishes a base of patients to enroll in future clinical research that will allow more therapies for PCD.
We still have so much to learn about PCD. And the way that we're going to do that is through the PCD Foundation Accredited Centers of Excellence.
When I started the PCD Foundation, I was quite a bit younger and a little starry-eyed. It's taken us 20 years to get to this point. We are small but mighty. We are getting a lot done. The future looks bright for PCD research.
Thank you to our PCD experts for the accreditation overview. We are proud to be providing high-quality diagnostics and cutting-edge treatment and care through our center's network and are lucky to have you at the helm. I'd now like to introduce Dr. Paul Moore from Monroe Carroll Jr. Children's Hospital at Vanderbilt. Dr. Moore will be presenting Dr. Michael O'Connor with the Passion, Care, and Dedication Award, recognizing his outstanding work in the education, diagnosis, prevention, treatment, and cure of PCD. Without further ado, here is Dr. Moore.
Thank you, Amy. I am Dr. Paul Moore, Director of the Division of Pediatric Allergy, Immunology, and Pulmonary Medicine at Vanderbilt University Medical Center. And I am thrilled to introduce Dr. Michael O'Connor today as he receives the Passion, Care, and Dedication Award from the Primary Ciliary Dyskinesia Foundation for his contributions to the PCD community. Michael joined our division and the faculty in the Vanderbilt University School of Medicine in 2016 after completing residency in pediatrics and fellowship in pediatric pulmonology. Starting in fellowship, Michael shown keen interest in PCD and was instrumental in setting up nasal nitric oxide testing prior to our accreditation in the PCD Foundation Clinical and Research Centers Network. Michael is an outstanding clinician, educator, and physician scientist who focuses his entire efforts on PCD. As a clinician, he was recently named at our institution with the Excellence in Patient Experience Award as one of the top providers in pediatrics. He has built our center from scratch and contributed to many other centers throughout the US coming online through his peer mentorship. As an educator, he's given grand rounds at multiple institutions throughout the US and most recently at our institution. He's a great ambassador for the PCD Foundation. He's delivered abstracts and research talks related to his own work and was recently named medical director for the PCD Foundation North American Clinical Registry, an important step forward for clinical research in PCD. Dr. O'Connor has truly transformed the care of infants and children with PCD at our institution. His receipt of the PCD Award is national recognition of the passion, care, and dedication to PCD that extends far beyond Vanderbilt. Michael, we're just thrilled for you to receive this award. I can think of no one more deserving. Congratulations. Thank you.
Thank you, Dr. Moore, for that kind introduction. And thank you so much for this incredible honor as this year's recipient of the PCD Foundation Passion, Care, and Dedication Award. Working with the PCD Foundation has been a truly rewarding experience, and I am so proud of everything that we've been able to accomplish in the past several years, especially in terms of the launch of our clinical registry. The clinical registry will serve as the foundation for PCD clinical advancement in the coming decades, allowing us to better understand the natural history of PCD, as well as the variations in clinical presentation for individuals with PCD. The data harmonization aspects of the registry will allow us to eventually bring together important PCD-related data from different sources, and the clinical trial readiness aspect of the registry has already begun to build a contact list of individuals with PCD interested in participating in clinical research. We are also excited for the registry to be open and enrolling participants and can't wait to expand to other PCD clinical centers this coming year. One of the awesome things about the PCD Foundation is that they have so many individuals that display passion, care, and dedication for this cause every single day. I'm just so humbled and honored to be a part of the effort to improve the lives of individuals with PCD through efforts like the clinical registry, and so appreciative of this award, as I think it represents all the amazing things our organization has accomplished and is set to accomplish in the years to come. Thank you again for this remarkable honor.
Congratulations, Dr. O'Connor. You have made such an impact on our disease, and we are so grateful for your partnership and commitment to a cure. I can see the donations are coming in already. You still have time to help us reach our goal of $200,000. Gifts can be made online through our event page, or if you opted in to receive text messages, you can make gifts directly from your phone. And now we have a special video to share with you tonight featuring PCD patient Eric and his mother Lisette. We are grateful to them for taking us along on their PCD journey.
I always tell people he was born with a cough. Eric was about a month old when my husband and myself and my mom took him to the emergency room because Eric wasn't breathing right. I kept asking my mom, is he okay? Is he breathing? Is he alive? So that 12-minute drive to the hospital seemed like it was an hour. That was the scariest moment for me as a mom. He had stopped breathing for a period of time. He just looked lifeless. He was on the ventilator and was connected to so many machines and tubes. I just cried. Eric had been seeing a pulmonologist for a while. She referred us to come to Lurie Children's. It wasn't until we started coming to see Dr. Laguna that we got a diagnosis.
When we met Eric, he had certainly gotten good care from his outside provider. However, it was really unclear exactly what he had.
He was about 7. We finally got the PCD diagnosis.
PCD stands for primary ciliary dyskinesia, and it's characterized by tiny little finger-like projections that are on many cells throughout your body that aren't formed right or they don't move right. This makes mucus very hard to move and puts you at risk for lots of infections in your ears, sinuses, and lungs. Diagnosing and adequately treating and managing PCD can dramatically impact a person's life and quality of life, especially in children. PCD is often either under or misdiagnosed because the symptoms overlap with many other things.
I was happy that I finally knew what I had, but at the same time, when I found out that you can't cure it, then I felt kind of sad because I was gonna have it for the rest of my life.
Do we have a cure for PCD? No, not yet. There are a number of treatments that exist, and at this point, they all focus on managing the complications. Having a multidisciplinary team is key to the success of what we do. You need a genetic counselor that has expertise in understanding what all those changes in the DNA mean. Respiratory therapists who have expertise in how to move mucus, how to do the diagnostic tests like lung function or nitric oxide. You need a nurse coordinator who serves as the person and the first contact for these patients and providers doctors, an ear, nose, and throat doctor, a heart doctor, an infant doctor.
I know Eric is getting the best treatment here. They explain things very well to us as parents and to Eric.
One of the first things that we did was really to implement effective, what we call airway clearance. And that's something that Eric does twice a day, every single day.
I do what's called a smart vest. It shakes me to help me get all of the dust and mucus out of my lungs.
Today, Eric is doing really well. He's just like any other little boy that plays soccer and runs at the park. But Eric continues to cough every day. He has nasal congestion, it's ear drainage. This is every day. It's never going to go away.
The community has come so incredibly far over the past number of years. However, we're only just scratching the surface. Part of the vision of the PCD Foundation is to create a network of PCD centers of excellence for kids and adults throughout the country who don't have the in-house expertise, who may not have access to testing at their own facility, to refer and come to a PCD center of excellence, where here at Lurie Children's we have the personnel, the equipment, the ability to make the diagnosis and pivot to creating a management and treatment plan. Our goal at some point, and this is through the help of clinical trials and clinical research in partnership with the PCD Foundation, is to do further study on the specific kinds of PCD and develop treatments that actually treat the disease, not just the complications.
Eric chose to be part of the clinical trials in order to help other children.
I want to be a scientist. I want to try to help make a cure for PCD for anyone else that has PCD.
It's important to donate to organizations like the PCD Foundation. We need the funds for continued research. As a parent, I hope there's a cure for my son and for other children and other adults that have to live with this disease for the rest of their life.
Eric and Lisette, thank you so much for sharing your impactful story with us. We are truly so appreciative of your time and effort. This evening, we achieved so much in our time together and gained a lot as well. I hope you leave tonight with a greater understanding of the PCD patient experience and how important the PCD Foundation Clinical and Research Centers Network is to increasing confidence in care, participation in research, and excellence in rare disorder education. While the evening is concluding, the work continues. We are relentlessly focused on clearing the way for the PCD community, and we cannot do this alone. Your philanthropic support motivates and moves our mission forward. Thank you for joining us tonight, and thank you for your generosity and partnership as we clear the way to breathe better, to support research, and to find a cure. Thank you.